Okay, recording diagnosis and management plans. It is important to record a summary of your diagnosis and suggestions to the patient. This is useful for several reasons. 1. It is important legally to document all your diagnosis, treatment suggestions of referral, etc. Similarly, it provides valuable support when dealing with patients who return with complaints that you didn't provide advice regarding the management of a certain condition. It ensures that you must review the case history and discuss each of the patient's symptoms and review the record card and deal with any significant findings. In subsequent examination of the same patients, a review of the problem plan list provides a thorough and complete summary of the examination without having to read the whole record card. The problem or diagnosis plan list. The problem plan list appears to be the only formal procedure that can be described to document a patient diagnosis, treatment suggestions, further investigations necessary, comments made to the patient, etc. The problem plan list is part of the problem-oriented examination. If a diagnosis cannot be made, then the patient's problem, that is the symptoms and/or sign, should be listed, and a list of the further investigation required to attempt to obtain a diagnosis should be listed in the plan section. Procedure. List each separate diagnosis in a column. Do not list the individual symptoms and signs that allow the diagnosis. Order diagnosis with the most important first. 2. If a patient has symptoms for which no diagnosis has been made, include the symptoms in the problem list. Similarly, include any abnormal signs or test results for which a diagnosis was not yet possible in the problem list. By this method, any problems you do not immediately understand are highlighted, and this prompts the considerations of further investigation. 3. For each problem, outline a plan or a series of actions to be taken in an adjoining column. Consider including the following forms of plan. A. Treatment plans. B. Further diagnostic procedures required. C. Counseling provided. Counseling is a fundamental element in patient management. Effective counseling requires that all diagnostic and therapeutic plans be clearly stated to the patient in terminology that they can easily understand. Example. Problems. First time mild plan RX for the whiteboard TV. Counsel to read and play with RX. Counsel regarding typical progressions and future changes in myopia, given leaflets. 2. Moderate proton. Counsel regarding color vision problems and effect on career choice, given leaflets. B. Hyperope and presbyope. RX PAL, used previously. Counsel regarding typical progressions of presbyopia. 2. High IOP and large CD ratio. Appointment made for full threshold visual field and corneal. Counsel regarding reason for extra tests.